going to answer the case study questions. So we had Mrs. Phillips who came in with 84 years old. She came in the emergency room. She was having altered mental status, confusion, weakness. The nurse inserted 2 large bore PIVs and draws blood for chemistry and complete blood count. The care provider thought that she might have had a stroke. So if she did have a stroke, the initial nursing assessments that would be performed would be to check the patient's balance. If they do have a stroke, they'll have a sudden dizziness or loss of balance. You want to check their eyes. They can have difficulty seeing out of one or both of their eyes. You want to check facial symmetry. One side of the face may be weakened and show drooping. Their upper extremities, the patient may have weakness and they won't be able to raise both of their arms at the same time. And their speech too will be impaired or slurred, and their level of consciousness, they may be a little bit confused or So the diagnostic tests that the nurse would anticipate for Mrs. Phillips at that point would be like a CT scan for the brain, which shows a detailed image of the brain. MRI detects any damage from the brain tissue if there was a stroke. Carotid ultrasound shows a buildup and blood flow in the carotid. And then echocardiogram shows clots in the heart that could have traveled to the brain and caused the stroke. So then they got her vitals and did the CT scan and didn't find anything. Neurologist did not think she was having a stroke. Her blood pressure, the nurse noted that her urine did smell foul and sour odor, and her blood pressure dropped to 88/52. So now the orders that we would anticipate with a provider is a urinalysis to look for the infection, a urine culture which identifies what's causing the infection, and then a CBC. You can also monitor their white blood cells because those will be elevated, which would indicate an infection. Things that might be going on with Mrs. Phillips physiologically. So if she is having a UTI, this occurs when bacteria enters the urethra, and where then it goes to the bladder and can form the infection in that bladder, and it can spread to the bloodstream. The symptoms Mrs. Phillips may have been developing are increased urine output, pain when she's voiding, urine that smells foul and it's cloudy and dark, that she can have fatigue and malaise. So then the care provider ordered then to keep her pulse ox at he wanted more than 92%, blood cultures ×2, urinalysis, urine culture, 500 milliliters of normal saline, IV bolus stat, 100 milliliters of normal saline, IV continuous infusion, and vancomycin, 1,000 milligrams IV ×1. So which order should be implemented first? It should be the 500 milliliters of normal saline IV bolus, because it says that it's on the orders as says stat. So the nurse obtains 2 sets of blood cultures and a UAP, obtains a sterile urine specimen through intake and output catheter. The UAP reports cloudy, foul-smelling urine. The nurse initiates the IV fluid bolus and requests vancomycin from the pharmacy. So then Miss Phillips' caregiver asks why she's confused. So she's confused because the UTI can get worse and it can enter the bloodstream and pass to the blood and brain barrier and cause confusion. And with UTIs, confusion is common for older adults anyway. So after 3 days of treatment with IV antibiotics, Miss Phillips is awake, oriented ×2 to 3. She has dementia. She's calm. She will be discharged with by mouth antibiotics tomorrow. Discharge teaching that you could provide to Mrs. Phillips and her caregivers at the nursing home is to help prevent from the UTIs happening again, is to wipe from front to back, avoid any scented hygiene soaps, douches, or sprays. If she is sexually active, to cleanse that genital area before and after sex. empty the bladder frequently, drink plenty of fluids, wear cotton underwear, you can drink cranberry juice, and you want to take those full prescription of antibiotics because you don't want the infection to reoccur. All right. So then if I'm reporting off to my nurse, I'm going to state that Mrs. Phillips is 84. She came to the emergency room. She had at that time, her altered mental status, confusion, weakness. They did a blood count. They thought she had a stroke. So they took tests. A CT scan came back negative. Neurologist said she didn't think that she was having a stroke. Her blood pressure, her vital signs were 122. Her heart rate was 122. Respirations were 24. Blood pressure was 92/58. Pulse ox 92%, and temperature was at 103.6. Then her blood pressure dropped to 88/52. The caregiver then gave orders for her to keep her pulse ox at more than 72%. 2 blood cultures, urinalysis, urine culture, 500 milliliters of normal saline, IV bolus stat, 100 milliliters an hour of normal saline, IV continuous infusion, and vancomycin, 100 milligrams IV times 1 dose now. So got 2 blood cultures. Reported her urine did smell foul and it was cloudy. So they gave her IV fluid bolus and gave her vancomycin. Then after 3 days, her treatment with the antibiotics, she was alert and oriented times 2 to 3. She does have dementia. She was calm, able to ambulate, and she will be discharged with by mouth antibiotics by tomorrow.